Morning, sir. My name is Eli. We're doing a focused assessment of a few body systems today. Before we get started, I'm going to practice some proper hand hygiene for my safety and yours. First thing I want to do is get you in the proper patient position. So lay flat on your back, supine position, head of bed elevated at 30 degrees. We're going to start with general inspection of your precordium. I'm going to look at this mid-chest area. I'm looking for lifts or heaves. Any sign of that might be indicative of a further problem like right ventricular hypertrophy or dilation. I don't see any, so we'll continue. We're going to start with palpation of your costochondral junctions. That's the area where the ribs meet your sternum. So I'm going to apply a little firm pressure here. Let me know if you have any tenderness or discomfort.
No.
All right. We're going to go over here to the PMI, point of maximal impulse. That's located fifth intercostal space, mid-clavicular line, about 7 or 9 centimeters left of the sternum. Apply a little pressure. I'm looking for a light, brief tapping. Tells me the left ventricle is contracting. Anything further, sustained, displaced, tells me you might have left ventricular hypertrophy or dilation. All right, no abnormal findings. Now we're going to auscultate your carotid arteries. The reason we auscultate first instead of palpation is, let's say you have a bruit, I miss it, that could dislodge the clot, cause further problems. So I want you to take a deep breath for me and hold. All right, breathe regularly. Deep breath, sir, and hold. All right, fantastic job. I'm going to palpate those arteries real quick. Breathe regularly. Oh yeah, pulses are nice and strong, +2. All right, sir. We're going to continue with some auscultation. I'm going to look at the 5 points of auscultation, 8 demand. We're going to start with our aortic, second intercostal space, right of the sternum. Pulmonic, second intercostal space, left of the sternum. Erb's point, third, left of the sternum. Tricuspid's going to be 4th and 5th, left sternal border. And then we're going to go to our mitral valve. It's going to be, once again, in that PMI, point of maximum impulse, 5th intercostal, mid-clavicular. All right, we're going to do an aortic valve screening. What I want you to do for that, sit up for me. I'm going to ask you to take a deep breath, exhale, hold your breath. We're going to repeat that process. I'm looking at that second intercostal space, left sternal border. That's going to bring the heart closer to the chest wall, making any abnormalities more audible upon auscultation, okay? Still using our diaphragm. Lean forward for me. Deep breath, in, out. Hold your breath. One more time. All right, no abnormalities noted. Go ahead and lean back for me one more time, sir. We're going to switch to the bell of the stethoscope. I'm going to examine the tricuspid one more time, 4th and 5th intercostal spaces, left sternal border. Just breathe regularly for me, sir. I'm going to look at a few places. All right, and then we're going to look at your mitral. Once again, 5th intercostal, mid-clavicular. Okay, we're going to do a mitral valve screening. Go ahead, left lateral decubitus position, lay on your left side for me, sir. Looking at that PMI one more time. Regular deep breaths, in, out, hold, in, out, hold. No whooshes or whoops indicating mitral valve regurg or prolapse. So now we're going to go on to our abdominal examination, okay? I'm going to lower the bed real quick. There you go, sir. I'm going to bring this out. Put your feet on that. Bend at the knees, arms to the side. Relax. Fine. Breathe in and out regularly. Inspecting the abdomen, looking for scars, striae, rashes, dilated veins, bruises, bulges indicating umbilical hernias. I don't see any. Abdomen appears flat and symmetrical. So we're going to auscultate the abdomen. Always auscultate before you palpate because that can disrupt the bowel sounds. Use the bell of the stethoscope for abdominal vasculature, the diaphragm for bowel sounds. We're already using the bell, so we're going to stick with that. Right upper quadrant and renal artery. Okay, left upper quadrant and renal artery. All right, left lower quadrant, iliac artery. Right lower quadrant, iliac artery. We're also going to do our aorta. Looking for any signs of a bruit indicating aneurysm or stenosis. No such findings. Abdomen, bowel sounds are present, regular, normal borborygmi or rumbling. You could also percuss the abdomen. You'd find general tympany over those air-filled areas and then dullness over the organs. We're not going to do that, however, we are going to palpate. So hands together, a little light palpation and a dipping motion. We're going to assess these 4 quadrants, looking for signs of pain, discomfort, or distress. Any, sir?
No.
Okay. Once we've completed this 4th quadrant, we're going to go into a little deeper palpation. Now we're looking for severe pain. We're looking for rigidity of the abdomen. We're looking for acute abdomen peritonitis. Any pain, sir?
No.
Okay. Now that we've done that, we're going to percuss and palpate our specific organs. So we're going to start over here with the liver. So I'm going to place my left hand over here at the mid-clavicular line. What I'm going to do is I'm going to percuss down to about this costal margin. What we're looking for is a change in sound. So starting here, right there at the costal margin is where I'm hearing it. That's an expected finding. We're going to go down to this right lower quadrant, work our way back up. Once again, looking for a change in sound. Right at that costal margin, what we expect. We're going to come over here to the spleen, anterior axillary line, last rib space, about right here. We're going to keep this hand stationary. I'm going to ask you to breathe in and out deeply. That's what's going to move our hand. What we're expecting is no sound change. That's an appropriate finding. You would expect a sound change with an abdominal spleen like splenomegaly. Now we're going to palpate. So what I'm going to do, I'm going to take this left hand under your 11th and 12th ribs, left lower thorax. I'm going to lift up. Right hand's going to be right here in this mid-right lower quadrant. Take deep breaths for me. What I'm expecting is for that liver to move down and touch my fingertips. We're expecting it right at that costal margin. Another technique you could use a hooking technique. Come at an angle like this. Keep taking deep breaths, sir. You can actually get up and under the liver there. For the spleen, left hand's going to go up, pull the ribs forward. Right hand's going to go right at that costal margin. Deep breaths for me, sir. Now, the spleen's only palpable in about 5% of the population, or once again, those with splenomegaly. So it's a normal finding if I don't feel it, and I don't. We're going to palpate the kidneys one at a time. Deep breath for me. Inhale, exhale, hold. I'm going to try to grab the kidneys like a sandwich from either side. All right, same process. Inhale, exhale, hold. Okay, last big thing, the margins of the aorta. Aorta is typically about 2 finger widths wide, 2 inches above the umbilicus, or in an abnormal anatomy, 4 inches below the xiphoid process. So I'm going to locate our pulsation here like any other artery. All right. Now, fingers together, I'm going to trace the outline of the pulsation until it diminishes. Okay. Opposite side. And yep, it's about 2 finger widths wide, and appropriate finding. Now we're going to move to our peripheral vasculature, sir. So I'm going to examine our femoral artery, our pulse. Sorry about that, sir. Going up to the crease of shorts, examine to the ipsilateral radial pulse. Pulsars are +2 strong regular. Repeat that on the opposite side. +2 strong and regular. We've already got the stethoscope on the bell setting, so now we're going to assess for the presence of the femoral bruit, just like we did with the carotid and the aorta. All right. Just continue to breathe regularly for me, sir. I'm going to bend your leg like a 4. What I'm assessing for are inguinal lymph nodes. I'm assessing for any masses, any bulges. It's important to go up to the crease, down to the inner thigh, examining the horizontal and vertical chain. We're going to repeat the process over here. Okay, going up to the crease, down to the inner thigh, horizontal and vertical chains. Okay, no abnormal findings. We're going to look at our pulses. We've got our posterior tibial, our dorsalis pedis, or our pedal pulses. So I'm going to look here on the medial aspect of the foot. Okay, examine on the top of the foot. Pulses are +2 strong, regular, equal bilaterally. We examine the presence of any peripheral pitting edema. I'm going to apply some firm pressure over our bony prominences. Hold for about 5 seconds. 4, 5. Release. No significant edema noted. All right, so we've concluded that. So we're going to go on to our neurological examination, okay? So you can sit up for me. We're going to look at nerves 1, 5, 7, 11, and 12. Not necessarily in that order, but we are going to start with nerve 1. That is our olfactory sense of smell. So what I want you to do is close your eyes, occlude one nostril for me, and tell me what you smell, okay?
No.
Nice job. And we're going to do the next one. What do you smell?
Got it.
Okay, keep those eyes closed. We're going to look at our facial sensory function, our sense of taste, okay? I'm going to put something in your hand. Let me know what you taste. There you go, sir.
Peppermint.
All right. Keep those eyes closed. We're going to look at our trigeminal sensory function, nerve 5. I'm going to touch either side of your face. Let me know when you feel it and where you feel it.
Forehead.
Okay.
Jaw, cheeks.
Okay.
Chin.
All right. We're going to stand that trigeminal. We're going to assess our motor function, contraction of those masseter muscles. You can open your eyes. Push against my hand. Clench, close that jaw. Nice job. We're going to look at our facial motor function. So raise your eyebrows, close your eyelids, puff out your cheeks, smile for the camera. All right. Next thing we're going to do is nerve 11, our spinal accessories, okay? So rotate against resistance. All right. Rotate against resistance. Shrug those shoulders. And we're going to look at nerve 12, our hypoglossal function. Stick out your tongue midline. Fantastic job. All right. Grabbing our next tool, we're going to look at our deep tendon reflexes, okay? So extend that arm for me. Try to locate that tendon here. This is always an awkward thing. Relax that arm for me. All right. Okay. I'll come over here to the opposite arm. Look at our tendon here. All right. Okay. We'll move on to our tricep, okay? Going to that tendon right behind the elbow. Just relax that arm for me, sir. See if we can see your hand, back of your arm. Okay. Same process over here. You're doing great, so just try to let it dangle, relax, the tendon right behind the elbow. Okay, we're gonna get our patellar. We're gonna go right below the kneecap. All right, below the kneecap here. All right, we're gonna get our Achilles. Key here is dorsiflexion, so extend just like that, sir, lengthen that tendon. All right, same process here. All right, we'll do our plantar. Using this side of the reflex tool, we're gonna go from heel to toe. We're looking for as a normal or negative Babinski. Toe's gonna try to grasp just like that. All right, we're gonna test our cerebellar function. Start with rapid alternating movements. Hand, rotate. Repeat, rotate. Take your toes, tap against my hands. Nice job. We're gonna test their coordination and proprioception. What I want you to do, raise your right arm, touch your nose, touch my finger. All right, this is testing our coordination. Return midline, close your eyes, continue to do it. Proprioception. All right, left hand up, touch your nose. Coordination, okay? Return to midline, close your eyes, and proprioception. Nice job, sir. We're gonna test our pronator drift. Arms up, out, palms up, eyes closed. You would hold this for about 20 to 30 seconds, assessing for motor neuro weakness, deficits. He has none. Patient looks good. Lower those arms, sir. We're gonna test our heel to shin. Heel, shin, drag up and down. All right, repeat with the other leg. Nice job, sir. We're gonna test our sensory status, okay? Let me see your hand. Sharp side, dull side. Close your eyes. I'm gonna touch 3 spots of either arm, 3 spots of either leg, either side of your sternum, either side of your spine, okay? Tell me what you feel.
Sharp.
Okay.
Dull.
Mm-hmm.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Yep.
Sharp.
Nice.
Sharp. Sharp. Sharp.
Okay.
Dull. Sharp. Dull. Sharp. Sharp.
Okay.
Dull.
Okay.
Dull.
All right. We're going to do a monofilament test. Once again, I want you to visualize and feel it. We're assessing for diabetic peripheral neuropathy. Close those eyes and see those feet. We're going to touch the 3 metatarsal heads, okay?
Feel it. Feel it. Feel it. Feel it.
Once again, 3 metatarsal heads, base of the big toe.
Feel it. Feel it. Feel it. Feel it. Feel it.
All right, fantastic. Sensory status is intact, sir. Last big test, our motor status. Go ahead and stand up for me. Go to this wall. We're assessing ambulation and gait. Walk to that wall, looking for arms swinging appropriately by the side. Walk back on your big toes, or your toes rather. Walk back on your heel. And last big test, tangent gait. Like you're on a tightrope, heel to toe. Nice job, sir. Okay, we're gonna test our balance. Hop on one leg at a time. Okay, swap legs. All right, last big exam for balance, our Romberg test. Close your eyes. Heels, toes, feet together. Arms by the side. Stand nice and still for me. Deep rest. You hold this for about 20 to 30 seconds. Stand at the patient's side just in case they lose their balance. You could catch them if they were to fall. All right, so that concludes our exam. Do you have any questions, comments, or concerns for me?
Yes, sir.
Thank you for your time.